Ever worry that your cholesterol numbers might be putting you at risk? You're not alone. Many people see their cholesterol levels but have no idea what they mean for their heart health. Cholesterol numbers can tell you more about your risk of a heart attack or stroke than almost any other test. But how do you read them, and what exactly do those ratios mean? What is cholesterol? Cholesterol is a fat-like substance that lives in your cells and helps your body make vitamin D, hormones, and the digestive enzymes you need to process food. It's not something you can get rid of completely, and you don't want to. However, if you have too much of it, cholesterol can start to bind with other substances in your blood, forming sticky plaques that can clog your arteries. When your arteries narrow, it becomes harder for blood to pass through, which increases your risk of heart disease, stroke, and other cardiovascular problems. Cholesterol panels, the breakdown A cholesterol test, also called a lipid panel, is one of the most common blood tests doctors order to assess heart health. Here's what it measures and why each part matters. 1. Total cholesterol. This number combines both good and bad cholesterol in your body, giving you a general sense of your cholesterol levels. But don't let this number scare you on its own, we need more detail to understand the full picture. 2. HDL, high-density lipoprotein, often called the good cholesterol. HDL actually helps transport cholesterol away from your arteries to the liver, where it's removed from the body. Higher HDL levels are a good sign. It means your body has a system for managing and reducing cholesterol buildup in your arteries. Ideally, your HDL should be above 60 mgdl, but at least above 40 mgdl. 3. LDL, low-density lipoprotein. This is the bad cholesterol. LDL tends to build up in artery walls, creating blockages that can lead to a heart attack or stroke. Health experts recommend keeping LDL below 130 mgdl, and ideally under 100 mgdl. 4. VLDL, very low-density lipoprotein. VLDL mostly transports triglycerides, another type of fat, through your blood. While it's not as common to discuss VLDL as part of the standard cholesterol numbers, it does contribute to artery blockage and should be kept under 30 mgdl. 5. Triglycerides. These are fats that store extra energy from food in your body. Triglycerides alone aren't cholesterol, but high levels combined with high LDL can cause serious buildup in artery walls. Aim for levels below 150 mgdl. Calculating your cholesterol ratios. You might ask, why do we talk about ratios? Ratios can reveal a lot more than any single number alone. Here's a breakdown of the most common ratios used and what they can tell you. Total cholesterol to HDL ratio. This ratio divides your total cholesterol by your HDL. Health experts categorize these ratios as follows: ideal, under 3.5 good, under 5.0 bad, over 5.0. A higher ratio indicates a higher risk of heart disease. For instance, if your total cholesterol is 240 and your HDL is 60, your ratio is 4, a moderate risk level. Keep this number low by raising your HDL through exercise and healthy eating habits. LDL to HDL ratio. The LDL to HDL ratio is one of the most popular ways to measure your heart disease risk. Ideal, under 2.0 good, under 5.0 bad, over 5.0. For example, if your LDL is 100 and your HDL is 55, your ratio is 1.8, putting you in the healthier range. This ratio is especially important for understanding the balance between the bad and good cholesterol in your blood. Triglyceride to HDL ratio. This ratio is less common but can still give insight into your cardiovascular risk. Studies have shown that higher ratios may signal a higher risk of metabolic syndrome. Ideal, 2.0 or less good, between 4.0 and 6.0 bad, over 6.0. Non-HDL cholesterol ratio. Subtracting your HDL from your total cholesterol leaves you with all the bad cholesterol combined. This measurement highlights the non-protective forms of cholesterol in your blood. Why do these ratios matter? Higher ratios may indicate an elevated risk for heart disease. LDL buildup is what creates those dangerous plaques in the arteries, so keeping it low in comparison to your HDL is crucial. In fact, A 2017 study found a link between higher LDL-HDL ratios and increased risk of sudden cardiac death, especially among middle-aged men. And while these numbers are important, they're not the full story. Cholesterol is a structural component in your cell membranes and is critical in producing hormones, vitamin D, and bile acids, which help with digestion. If you have low cholesterol levels, you could also face health risks, including a higher risk of intracerebral hemorrhage, which is bleeding in the brain tissue. Age and gender differences. Many people wonder if age or gender plays a role in healthy cholesterol ratios. The short answer is yes. People assigned female at birth, a FAB, generally have higher HDL levels than those assigned male at birth, AMAB, often due to hormonal differences. However, after menopause, HDL levels may drop, and LDL levels may rise, increasing heart disease risk. Screenings are essential. Health experts recommend that people ages 45-65 undergo screening every 1-2 years, while those over 65 should have annual screenings. Common questions about cholesterol ratios. What's a good cholesterol ratio? An ideal cholesterol ratio is 3.5 or less, but anything under 5 is generally considered safe. What's a bad LDL-HDL ratio? An LDL-HDL ratio over 5 suggests higher risk, while anything under 2.0 is ideal. Does a person's sex influence cholesterol? Yes, women generally have higher HDL levels, but risk levels remain similar for both men and women. What to do if your ratios are high? Lifestyle changes can make a big difference in cholesterol levels. Here are some steps to take. Quit smoking. Smoking lowers HDL, so quitting can help increase your levels of good cholesterol. Eat healthier. Focus on whole grains, fruits, vegetables, and lean proteins, which can help maintain good cholesterol ratios. Exercise regularly. Physical activity can improve your HDL levels and decrease your LDL. Limit alcohol. Moderate drinking may increase HDL, but too much can have the opposite effect. Manage stress. Chronic stress has been linked to higher cholesterol, so finding ways to relax is also beneficial. Conclusion: understanding your cholesterol ratios can empower you to take control of your heart health. These numbers aren't just abstract figures, they give you a clear picture of where your heart health stands. If your ratios are less than ideal, don't panic. Small lifestyle changes can lead to big improvements. Speak with your healthcare provider about ways to manage cholesterol effectively and ask about getting your levels checked regularly.